I'm your host, Aaron Fournier, and thank you for joining us on the Science of Sound. Today, we have a fascinating conversation about gut health and how our gut health is related to so many different facets of our body, from our immune system to our brain health. You're not going to want to miss this.
This is a Soaak podcast.
Welcome to the Science of Sound, where cutting-edge research meets real-world application. Hosted by Aaron Fournier, this podcast explores the fascinating intersection of sound, frequencies, and human performance. From the science behind bioharmonic resonance to the future of sound-based wellness, we break down the data, the discoveries, and the impact sound has on your mind and body. Let's dive in.
So, Dr. Paul Harris, thank you for joining me again on the Science of Sound.
It's my pleasure. Glad to be here.
Awesome. So, you've been studying health and practicing in this field for more than 5 decades now. And
Correct.
You're here to share some of that knowledge with us, some of the things that you're seeing in the clinic and what some of your patients are experiencing. And specifically today, we're talking about gut health, and we're going to talk about IBS and SIBO. And those are acronyms. Can we start just generally? What is IBS? What does that mean? And what's like a 100,000-foot view of IBS?
So, first of all, gut problems are the number one problem that most patients go to doctor's offices for. And I think over 74 million Americans have some type of gut issue. And so just a quick overview is IBS is irritable bowel syndrome, which is a syndrome or a collection of different types of gut symptoms like diarrhea, abdominal pain, constipation, alternating constipation, diarrhea, bloating, et cetera, and that's IBS. 60% of patients that have IBS also have SIBO, which is small intestine bacterial overgrowth. And we're going to go into more detail as to what bacteria, what all is involved. But it was Hippocrates who said that all disease begins in the gut, and that was many, many decades ago. And so that's why I would say 98% of our patients present with some type of gut disorder.
Interesting. So IBS really just means that you have some kind of discomfort in the gut. It's really, it's at its most basic level. Is that really what IBS means?
That's pretty basic, but yeah, for the most part, one of the features is bloating, what we call food babies. Mm-hmm. And a lot of patients will say, 10 minutes after I eat a meal, I have to let my pants loose, my belt loose, because I've got so much gas and bloating, and sometimes pain after they have a bowel movement. So any type of GI discomfort, gastritis, burning sensation, those are some of the more characteristics of IBS.
Right. And so like you were saying, this is a very common thing. Prior to this, I was reading, I think it's 5% of global population, but here in America, it's 10 to 15%.
Exactly. So that's like 46 million people or something like that.
Right.
And the other interesting piece of information is it takes 4 to 6 years to get diagnosed with IBS. And so a lot of our patients, they'll say, well, my doctor wants to put me on this medication, this anti-inflammatory, this NSAID, whatever. That may address some of the symptoms and give them symptom relief, but it's more important to find out, okay, what's involved here? What are some of the triggers for my gut problem? And since there's such an intimate relationship between the gut health and brain health, another symptom that I would add to that is also brain fog.
Oh, interesting.
And so brain fog and bloating and all of those kind of fit together neatly.
Okay.
And that what they call the syndrome.
Awesome. So let's dive deeper then into IBS. We've talked about the symptoms. What are some of the causes then? If generally if you were going to your regular doctor and after this 4 to 6 year process, you find out that, okay, you're diagnosed with IBS, you might receive some type of medication or some type of lifestyle change that might treat some of the symptoms of that. But what are the actual causes? Let's dive a little deeper.
So if you want to, what I have a health appraisal questionnaire, and it will cover the causes. This is characteristic of some of the major symptoms that patients come in the office with.
Okay.
And I can answer that question through reviewing the health questionnaire. Would that work?
Yeah, absolutely.
Okay.
And you can kind of treat me like I'm your patient here in this instance.
So let me change glasses here. So this is a health appraisal questionnaire, which is a very extensive questionnaire that we have patients fill out. And I'll give you an example. The chief complaint with this pseudo patient is chronic kidney issues, digestive issues. And by the way, another feature of IBS is, unlike IBD, which is irritable bowel disease, it involves the small and large intestine. So that's what we're talking about today.
Okay.
A syndrome that affects small intestine, large intestine. Small intestine is about 20 plus feet, 20, 22 feet long. And you've got the three parts. You got the duodenum, the jejunum, and the ileum. So you got three different parts of the small intestine. So let's just go through again, the chief complaint is, I want to figure out a plan to better help my gut health. And this particular patient also had food poisoning. Now we're going to your point, we're going to talk about what role does food poisoning have in IBS or SIBO or gut issues. So 1 out of 9 individuals, for example, that have had food poisoning end up with IBS.
Interesting. Okay.
And
so what's the correlation there?
That's very important to look at that and look at the correlation. Now, this pseudo patient also had gallbladder removed in let's say 2 years ago. So if you had your gallbladder removed, that actually can cause gallbladder diarrhea, because what happens is the bile is being secreted into the small intestine, makes its way into the large intestine, and then the bile salts interact with the bacteria and creates a toxic bile environment.
Okay.
And then that can trigger diarrhea. So that's part of the reason why it takes 4 to 6 years to actually get a diagnosis, because they'll come in with those kinds of symptoms, and the doctor will say, well, it's just your gallbladder, or it's just this or that, or you're just stressed out.
Interesting. Okay.
So the other complaint would be some of the symptoms, abdominal cramps, and this particular pseudo patient, intermittent abdominal cramps that occurs 1 to 2 times a day. Now we score them. 1 is mild, 2 is moderate, and 3 severe. So this patient scored 3 with abdominal cramps.
And that was for like the pain.
Yes.
But I would say frequency, if someone's having abdominal cramps
1 to 3 times a day.
1 to 3 times a day, that's a pretty significant.
Exactly. Yes. And another symptom would be, well, Dr. Paul, I have alternating constipation and diarrhea. And then I'll ask, well, is it more diarrhea or more constipation? Because that is a determining factor as to what labs that we might do.
Okay.
So this patient says, well, I've got more diarrhea. And again, 60% of IBS patients have SIBO. Another one is they will say, well, also I've got the pain, I've got the bloating, and I've got mucus in my stools. Well, if they have chronic mucus in their stools, then I want to think of possibly food sensitivities or food allergies.
Okay.
So with the food allergy, an IgE food allergy, that's when you consume a food and you have almost an instant response. You've got itching, or you get diarrhea, or you get abdominal cramping, or whatever. But 70% of food-related issues, as far as your health, is not IgE, but IgG. It's a food sensitivity. That symptom can occur 24 to 72 hours later. And so there's specific blood tests that can help determine that.
And when you say IgE and IgG?
That's an immunoglobulin response. It's an immune response.
Okay.
It's that particular flavor, IgG and IgA, IgM.
Okay.
IgM would mean it's an acute infection, an acute reaction. IgG means been there, done that, got the T-shirt, it's a footprint.
Okay.
But this can give us an indication of what foods are possible triggers. So to your earlier question, food sensitivities can play a role in gut health and IBS, et cetera. Another very important feature is frequently the patient will say, I have foul-smelling stool. And this is scored 3. And if the husband is there or the wife is there, they'll sit there and shake their head. Absolutely. We all have to leave the room. So what role would foul-smelling stool and what your stool or your gas smells like, what would that have to do with this podcast? For the simple reason, if it smells like rotten eggs or sulfur, then that can be an indication that the particular bug that's creating the problem is hydrogen sulfide.
And you're talking about like types of bacteria?
It's the bacteria and the gas. It's actually the gas is being produced which is
by
an
your
interaction.
gut microbiome.
It's an interaction that's occurring because of the gases being produced as it's feeding off of the food.
Okay.
And so if it's hydrogen sulfide, it's extensive diarrhea, or if it's hydrogen, it's diarrhea and loose stools, or if it's methane, which is an archaea, it's not really bacteria, then the symptom would be more constipation. So that's why we pay close attention as I'm going through this. Okay, so is it more diarrhea? Is it more constipation? That provides clinical specificity in terms of what labs do I need to do, what nutraceuticals, what medication,
how to
et
start
cetera.
treating it, and resolving the issue.
So,
okay.
Versus
just giving somebody
exactly.
gas X. Or...
So this is not a kindergarten conversation. This is a big boy conversation on a very significant problem with many millions of people in the United States. Yeah. So the two bugs, let's say it's hydrogen sulfide or even hydrogen. So it's a bacterial issue. And so the two primary bugs in that is E. coli and also Klebsiella pneumoniae. Those are the two prominent bacteria that's contributing to the symptoms that we're talking about.
And so mentioning E. coli, then is this how someone that has food poisoning, how that kind of relates to the story?
Okay,
Can you get a bad E. coli overgrowth because of food poisoning, I guess?
Let's just go into that. As I stated, 1 out of 9 individuals that have SIBO have had food poisoning. 60% of patients that have IBS have SIBO. And so the role that food poisoning plays is you've got Shigella, E. coli, Salmonella, Campylobacter. Campylobacter is one of the primary causes of food poisoning. So let's get a little deep in the weeds here and get a little more specific. With food poisoning, there's a common toxin with all of those 4 horsemen that I just described called CDTB, cytolethal distending toxin B. And that's the common toxin that triggers IBS. It gets a little more complex. There's another player. It's a gut protein that actually is called vinculin. And vinculin is a protein that causes propagation of the waves that we call migrating motor complex that helps to sweep out the bacteria and undigested food particles in the small intestine. And so the CDTB is molecularly similar to vinculin, and through a process called molecular mimicry, it creates an autoantibody. And so then this autoantibody, so really it's an autoimmune disease. And so now you've got this autoantibody occurring, and we might as well go ahead and just, I'm getting a little ahead of the game here, but you've got housekeeping waves and you've got digestion. There's 2 components to digestion, house cleaning waves and then digestion. So you digest your food, it's moving the food around, and the digestive juices are being secreted from the pancreas into the small intestine and the duodenum, first 10 inches of your small intestine. And if it's a carbohydrate, it takes about 2 hours to digest carbohydrate, or about 4 hours to digest a fat protein meal. That's the digestive component. When that stops, then the house cleaning waves kick in. Those are called migrating motor complex. These waves occur every 90 to 120 minutes, and each wave or sweeping action will last about 6 to 8 minutes, and it's cleaning out the bacteria and cleaning out the undigested food particles and moving it down toward the large intestine. You don't want a lot of bacteria in the small intestine. You want most of the bacteria you're going to find in your large intestine. Interesting. So the small intestine is pretty squeaky clean. But if that housekeeping wave is too slow, then it's allowing a buildup of this bacteria in your small intestine. Now, what are some of the things that can slow that down? Taking NSAIDs, taking a lot of antibiotics and medication. Pain medication will slow down these waves. Surgery can do it, like gastric bypass surgery can
because you're actually removing portions of the small intestine and gastric bypass.
Endometriosis, where you're getting an overgrowth of tissue that can invade the intestine, et cetera, et cetera. But this is surprising, one of the main culprits in this process is actually diabetes, because one of the features of diabetes is peripheral neuropathy. And what is peripheral neuropathy? It's damage to the nerves. And so the propagation waves occur because of nerves in the small intestine. And the vinculin is what pulls that trigger to initiate. You tracking with me?
Right.
Initiates this broom sweeping action to get rid of the bacteria, so you don't get a buildup of bacteria in the small intestine. It becomes too swampy. And so all of these things begin to allow this bacteria to accumulate. So again, the bacteria, you're wanting to digest the food and eat the food, but instead the bacteria buildup, the bacteria is eating and digesting the food, and it's releasing the gas.
Right.
So
Okay.
there's actually a breath test that can determine what gas is being built up. Is it intestinal methanogen overgrowth? Is it methane? Is it hydrogen? Or is it hydrogen sulfide? And so depending on the nature or the type of gas depends on the type of treatment. And so that's why it's so important to go through this and all of these questions with the patient to determine exactly what we're dealing with. So moving along, the other feature is depression and mood swing and brain fog that goes along with this as well, or anxiety or not being able to sleep because of IBS or SIBO. So the fuel for the small intestine is actually glutamine, and the fuel for the large intestine is butyrate. So here's the role that plays. Glutamine is an amino acid. So here's why it can contribute to, if you're low in glutamine, this is why it can contribute to brain fog and depression, et cetera, et cetera. So glutamine gets converted into glutamate. And in glutamate, in the brain, this is where this conversion occurs, glutamate, along with a cofactor B6 and magnesium, actually makes GABA, gamma-aminobutyric acid. That is an inhibitory neurotransmitter. Glutamate is an excitatory neurotransmitter. So if you've got more excitatory neurotransmitter activity, it's going to make it difficult to go to sleep. You're going to be more anxious. You're going to be more moody and less calming. It's the balance between the glutamate and the GABA that helps keep you on an even keel. So if you've got a gut problem and you're deficient, and by the way, I give patients, that's one of the healing nutrients I give patients that have gut problems, is the product that's rich in glutamine. And so then they digest the glutamine, the repair process begins, it gets converted to glutamate, and then GABA. So,
and that process all starts in your gut. It's all gut
starts
related,
in your gut,
which is leading
that's why
to
we're
the
having this
reason
conversation.
You can't sleep.
Exactly. So why you're not sleeping? Because you don't have enough GABA. And the molecule of GABA is too large. When you take a product that's got GABA in it, the molecule is too large to bypass the blood-brain barrier. And so that's why you want the glutamine, glutamate, then it gets converted in the brain into GABA.
It has to go through that specific
It goes through that process. And then if you're B6 or magnesium deficient, that plays a huge role because most people are magnesium deficient. So you don't have enough cofactors to promote that biochemical
to have the healthy
reaction,
balance,
to have that homeostatic balance.
Interesting.
And so again, there's an intimate connection between gut health and brain health.
Yeah. Well, and before we dive back in, you also mentioned something a couple minutes ago about autoimmune and a correlation there between our gut health and autoimmune diseases.
Well, again, SIBO and IBS is a type of autoimmune disease. I might add that the gateway for autoimmune diseases is actually the gut.
What do you mean by that?
I'm going to explain it. Most people don't realize that a good 70% plus of your immune system is in your GI tract. A huge part of
So say that again.
A good 70+% of your immune system is in your GI tract.
And that's fascinating because that's not something, I feel like that's not common knowledge. That seems really strange to me that my immune system is actually starting with my gut and my gut microbiome and the ability of me to have a healthy gut.
Okay, so let's expand on that a little bit. Why would that be? Why would God place your immune system in your gut? Because that's the source of exposure to most bacteria and toxic substances. You're drinking it and you're eating it. That's the gateway.
Okay.
And so as far as immunity, the big immune system in your gut is called GALT, which is gut-associated lymphoid tissue, GALT.
Okay.
And that's lymphoid tissue is dispersed throughout most of the intestine.
Well, and what are lymphoid tissues?
It's a special
because I've heard of lymph nodes.
Yeah, it's a special lymphoid tissue that can produce antibodies, and it's part of your body's Army, Navy, Marine Corps. It's part of your immune component, and so the GALT is very important. A feature of your immune system, and so again, if you've got a compromised gut and the GALT is compromised, and then also you've got the brush border cells, you've got villi in your small intestine, the little hair like shag carpet.
Okay.
And at the top of the hair, you've got brush border cells, and that helps to complete the digestive process. And so when you take an NSAID, for example, on a regular basis, it's like taking
and that's
sandpaper.
A pain medication, right?
Yeah, pain medication, ibuprofen, acetaminophen, etc., or prescription. It's like taking sandpaper and scrubbing that shag carpet. Now you don't have shag carpet, you've got Berber carpet.
Okay.
So that's
You're
damaging
decreasing the function.
That's damaging the immunity in your gut. So what happens is that also damages the tight junctions in the cells in your gut. So the junction should be like this. And so if you've got a leaky gut, and you've got elevated zonulin or gluten, then you've got this going on. So it's like in the cheesecloth, you've got too many holes in the cheesecloth. And now those food particles and the peptides and the different viruses, bacteria, and parasites are leaking between the cells, getting into the bloodstream, which invokes an immune response. Now you're producing IL-6, natural killer cells, and
so
that over time
autoimmune
contributes to an autoimmune condition because your immune system just gets in overdrive and hypervigilant, and it begins to think that the tissue is actually the enemy and begins to attack the tissue. A perfect example, oftentimes in autoimmune disease, Hashimoto's or thyroiditis, autoimmune thyroiditis, one of the huge players in that is actually gluten sensitivity. The gluten molecule is very similar to the thyroid cell itself, and so they're eating the gluten, they're eating the wheat, and then that tissue becomes incorporated, or the gluten becomes incorporated in the tissue, and the immune system thinks it's the bad guy. It starts to attack the tissue, and that can trigger an autoimmune condition. So that's why some of the top researchers are saying that the gut is the gateway for almost all autoimmune conditions, because you're getting things slipping through the cracks into the bloodstream that in that molecular size don't belong there. The immune system mistakenly perceives it as an enemy, and so it begins to mistakenly attack your own tissue in addition to attacking the pathogen that you're dealing with.
That's fascinating. And then would you say that inflammation is kind of the precursor of then autoimmune disease in this instance?
Inflammation certainly is a part of that. When it comes to autoimmune disease, you've got three stages of autoimmunity. You've got silent autoimmunity, where you've got elevated antibodies and you're asymptomatic. That can go on for years. Then you've got autoimmune reactivity, and that's where you've got elevated antibodies. The immune system now is you're beginning to present more symptoms, and then you've got full-blown autoimmune disease like Hashimoto's, and that's where you've got elevated antibodies, you're symptomatic, and now you've actually got tissue damage. So in that case, if your TSH is elevated, for example, that indicates that the thyrocytes are being destroyed. And so that's why it's such a complicated issue, and that you need to do these particular labs to determine that. It's like with IBS, is it really SIBO, or is it something else? Is it the surgery that's causing it, or is it the medication? There's a blood test that measures elevated antibodies to cytolethal descending toxin B and also to vinculin. And so if you've got elevated antibodies to those two markers, you know exactly, it can diagnose SIBO with 100% accuracy.
Wow.
So you need to know, is it SIBO, or is it IBS related to the medication, or stress can exacerbate it, and we need to go into what role stress plays, if you want to. There's another part of the questionnaire that we have patients complete called the limbic system questionnaire. And this is huge because the limbic system is the part of the brain that does threat assessment. And it assesses through your five senses. So if you're perceiving that there's a threat, you're running from a saber-toothed tiger, then the message gets to the hypothalamus. The hypothalamus calls the amygdala calls the sympathetic nervous system and your adrenal gland, and it starts to produce the stress hormones to mobilize the blood to your hands and your feet so you can run from danger or defend yourself. And that's just a natural mechanism. It can save our bacon. So what happens is that trigger finger goes to a 10, and it activates the sympathetic nervous system. Then you've also got the parasympathetic nervous system, which is the rest, digest, I'm healing, I feel safe. So once the sympathetic nervous system calms down and the danger's gone, and you've successfully outmaneuvered the saber-toothed tiger or whatever it is you're dealing with, then the trigger finger should go back to a 1 or a 0.5. It resets itself. But I'm finding in IBS, there's a lot of stress in their life, and so the trigger, they never reset. Or the trigger goes back maybe to a 3 or a 4. And then 6 months later, 3 months later, 3 days later, they get hit with another stressor, and it keeps moving up and up. So they get stuck at a 7 or an 8.
They're just getting more and more and more
So it
stressed.
doesn't take much to flip that switch, and your spouse will look at you and say, "What's that all about? Why are you so hyper today?"
Right. Why'd you have such a big reaction to something that
you
was
ate
seemingly
something?
so small?
Why are you having that reaction? That's because your trigger finger got stuck.
So there's a imbalance there in the limbic system.
Exactly. So the limbic system, you're stuck in a limbic system trauma loop. And by the way, this can begin in utero because your cells believe what you hear and what you say. And so if there was a lot of stress during the pregnancy, then that gets inscripted in your psyche, and that becomes part of your script that's playing behind the scenes 24/7.
Interesting.
And so that's why I help people flip their script and realize that's who you were.
That's some of like the generational trauma
Exactly.
that's
it's not
happening before you even come into the world.
That's not who you are now. That's who you were, and we need to work through it. So that compiled with the wrong diet and medications and having food poisoning contributes to the overall picture of IBS. And then if you got SIBO on top of it, it can make it very difficult to heal. So, the doctors typically, they'll prescribe something like rifaximin, which is an antibiotic, actually that I approve of. It's very expensive, but it works very effectively to treat SIBO, small intestine bacterial overgrowth.
Wow, that's fascinating. I'm just blown away right now that our ability to handle stress can actually be related to a digestive issue that we're dealing with. I would never have put those two together. But I hope that that's valuable for some of our listeners.
Well, it is, and that's why in the world of functional medicine, the primary difference in what we do in functional medicine versus conventional medicine, and we need both.
Right.
There's room at the table for both of us. So I'm not knocking conventional medicine. But in functional medicine, our goal is to dig deeper, look under the hood, and get as close to the cause as possible. Because if all we do is focus on the effect, which are basically symptoms, then you're missing an important piece. If you put out the fire and you give them something to shut down the inflammation, if the cause is still there, it'll pop up somewhere else.
Right.
And so it's important to spend. That's why I do these kinds of questionnaires. This takes an hour and a half with a new patient. We do a functional neurology evaluation. We look at their labs. We order labs.
Yeah, you're not just looking at gut health. You're
exactly.
looking at the full picture of the person.
We're looking at the whole team. You can't assess a football team by just looking at the quarterback. So you've got to look at the halfback, the tight end, the lineman, the whole teams, and that's what this is all about. That's why I'm taking the time to share with you. This is part of the feature of being a patient.
Right.
Is we spend time to get to the root, to look under the hood, to listen to your case, and listen to your symptoms, and look at your symptoms and how you're rating those symptoms. Just like with the gas, does it smell like rotten eggs? That's an important feature. I doubt if most doctors ask the patient, what does your fart smell like?
Right.
It just doesn't happen.
But it's a valid question.
It actually is a very valid question.
Illuminates,
And this information that I'm sharing today comes from one of the top gastroenterologists in the world, literally. So this is really valid stuff that's important, since the majority of patients are complaining with gut issues. It goes above and beyond taking Pepto-Bismol or an antacid. And by the way, another cause of SIBO is taking proton pump inhibitors. And these are things for acid reflux. It's the bacteria in your stomach that helps to keep it's the acid in your stomach that helps to keep the bacteria count down in your small intestine.
But if you're
taking antacids, you're reducing your acid content, so you're going to do a poor job of digesting and breaking down your fat and your protein.
And you're messing up the microbiome.
And a lot of these patients that have been on these proton pump inhibitors for years, they're also iron deficient because they're not breaking down iron. It takes HCl to break down iron. They're calcium deficient. They're developing osteopenia, osteoporosis, in some cases because they're not breaking down the calcium. And they're not killing the bacteria, and they're not killing the parasites. So
that's just amazing. It's amazing how interconnected all of that is.
Again, that's why I'm in functional medicine. I mean, I started out years ago thinking I wanted to, I was doing pre-med classes and started working for my dad in a health food store and had a major polarity shift in functional medicine. It just makes a lot of sense to look at the whole person. That's why they call it holistic medicine. And look at all of these, and it takes time to do that. It takes time to figure out a case. So not only do I look at this, but the patient, they'll bring in a stack of lab work that tall, and I'll look at it and I'll see some things that I think are borderline, and I'll say, well, what did your doctor tell you about this test result? Oh, they said everything was normal. And I'll say, well, not quite. If you've got a low normal or high normal, you can have just as many symptoms in some cases as a person that is way out of range low or way out of range elevated. And that's why you're just one step away from walking over the edge. Why do you want to wait till they walk over the edge and then try to grab them?
Right.
And so what we do with the assessment tools that we have in the lab test is look at the biomarkers that tell us you're moving toward a pathological state. The horse is out of the barn. It's not at the destination yet, but we need to make some changes now. We need to make some dietary changes. We need to make some lifestyle changes because you're stressed out of your mind, those types of things. So it's treating the whole person.
So speaking of making changes, what are recommendations if somebody knows that they have IBS or SIBO, or if now they're listening to this and this is really resonating and they're thinking, oh, this sounds like me. What can they start to do? What are some things that they can do themselves just to help with this?
Well, one of the most important things they can do, first of all, is de-stress and clean up their diet. I mean, if they're eating a lot of fermentable foods and a lot of carbohydrates and artificial sweeteners and those types of things, then this bacteria loves it. It ferments those types of foods. They're eating too much fiber. They can ferment those types of foods. They're eating a lot of yogurt, and
which is interesting because generally we've been taught that yogurt and
prebiotics,
probiotics are healthy for our gut microbiome. But there's a caveat that in certain instances it actually can exacerbate.
You've already got too much fermentation going on to begin with. This is a big piece. If you do have SIBO, then let's go back to the migrating motor complex. So every 90 to 120 minutes, the migrating motor complex kicks in. When you eat, you stop and then go into the digestive mode. And so you want as much time as possible between meals to allow for that sweeping action to clean out the crumbs off the table and off the floor. I recommend that a person, they've had a meal, wait 4 to 5 hours before you eat again or snack. I mean, if you're in the kitchen at work nibbling on bagels, half the day, then you're never in a cleaning mode. You're constantly in a digestive mode. Now, another thing that we do after we get the bacteria under control is we will give them, at nighttime, we'll give them a prokinetic, which helps to encourage that sweeping action, because that's when your gut is the cleanest and the clearest the longest while you're sleeping.
Right.
So you give
because
a prokinetic,
you're not in the kitchen snacking.
and it's kind of saying, it's kind of coaching along and say, okay, now you're supposed to be sweeping again and cleaning out the debris, etc.
Sounds like this really makes the case for intermittent fasting.
Exactly. So if you can go without breakfast, that's great. So watching your diet is incredibly important, and cutting out a lot of carbohydrates. The other thing that you can do, you can go online and buy a book on low fermentation. I'm not a big FODMAP diet person because it's the nutrients are too restricted, and you can't do that for more than a week or two, or you start to get weak and dizzy and have a lot of problems. But low fermentation, cutting out excessive fruits and sugars and high fructose corn syrup and pop, and a lot of fiber and beans and different things like that. And so the low fermentation is the best diet that I've recommended. Or if you want to do the paleo, even the paleo, which is kind of a low carb approach, but diet, exercise also plays a role. But de-stressing.
Well, because exercise helps you to de-stress. Yes. And so that's
exactly.
Earlier you were mentioning, the sympathetic and parasympathetic, that fight or flight, or getting into the all important rest, digest, heal state. So the foods we eat are very important.
Exactly.
And the timing of when we eat our foods is very important for the health of our gut.
Exactly.
But if we never get out of fight or flight, if we're chronically stressed,
you're not going to heal.
Then we're not digesting properly. We're not healing properly.
Now, one thing to add to that, we discussed the parasympathetic branch of your autonomic nervous system. The largest nerve of your parasympathetic nervous system is your vagus nerve. And the vagus nerve is responsible for all gastric motility, from swallowing to producing digestive enzymes to pooping. And it also is the off switch for inflammation. And so it's important to address that.
Yeah, absolutely. Well, thank you so much for joining us. It's always a pleasure to have you here in the studio with us, to share your knowledge with us. That was an amazing deep dive into our gut health and talking about IBS and SIBO, and something that I didn't realize affects so many of us, 10 to 15% of the U.S. population, 5% globally. But yeah, here in the U.S., around 45 million people. Yeah. Something I was reading earlier ahead of this, us sitting down together, is like 2 out of every 3 individuals at some point is going to experience IBS.
Exactly.
And so these are important conversations for us to be having. And I love how you can bring the interconnectedness. I had no idea how connected my gut health was to my immune system. And I feel like we could have a much longer conversation at some point
and to your brain
about
health.
Our immune system, but then our brain health as well.
Just remember this: gut inflammation, brain inflammation, neuroinflammation in the brain.
It's fascinating. Thank you so much for joining
You're
us.
Welcome. You've been listening to The Science of Sound with Aaron Fournier. If you found today's conversation insightful, be sure to subscribe and leave a review. For more resources on frequency-based wellness, follow along at Soaak Podcast. Until next time, keep listening, keep learning, and stay in tune with the science of sound.